Hi, I'm Nick the nurse. Today we're going to be talking about the nursing interventions for a patient who has an aortic aneurysm. The main goal when you have a patient who has an aortic aneurysm, whether it's unruptured or ruptured, is to control the blood pressure. Obviously, if it's ruptured, for shock, but more importantly, really, we don't want it to get to that point. We want to make sure that blood pressure is well controlled so that a unruptured aneurysm doesn't develop into a ruptured aneurysm, right? Because we don't want too much force exerted on the weak points or weak parts of a vessel wall. Accordingly, you want to make sure that the patient receives antihypertension medications, because if you'll remember from your studies, the best thing that a patient who does have hypertension can do is to make sure that they commit to a lifelong regimen of antihypertensive drug therapy. Extra important. Also, we want to observe for signs of aneurysm rupture, such as hypovolemic shock. If your patient has a ripping pain in their abdomen and their lower back, and they suddenly become hypotensive and develop tachycardia, and you have the classic symptoms and signs of shock, we obviously want to let the doctor know about that, or a rapid response team know about that. Very, very important. We want to keep the head of the bed no greater than semi-Fowlers, if the patient has a graft, because we want to prevent flexion of that particular graft. We also want to provide a warm environment to promote vasodilation. If you'll recall, we want the client or the patient to avoid things that cause vasoconstriction, such as tobacco or nicotine that we discussed in the video on signs and symptoms. Also, we want to make sure that we as nurses do not, repeat, do not palpate the mass in the abdomen. If there is a pulsating mass in the abdomen, let the doctor or provider know. That's not our job. Ooh, look, that's interesting. No. You want to make sure that you let the doctor know. That's above our pay grade at that point. We want to make sure that we provide medication for pain management. Obviously, we talked about in signs and symptoms that the patient's going to have excruciating tearing pain, whether it's unruptured or if it's ruptured, okay? We want to instruct the patient not to lift or conduct strenuous activity in order to avoid rupture. Obviously, heavy lifting can cause increase in blood pressure and exert force against the weakened parts of the vessel wall. We want to make sure that we anticipate the physician may operate on the aneurysm if it grows larger in size. Let me talk about that for a sec, because lots of people, remember I said everybody has aneurysms of some sort. Weakened parts in vessel walls throughout our body, whether it's in our heads, our abdomens, or wherever, any vessels in the body. That being said, lots of times a physician will say, hey, your aneurysm is less than 5.5 centimeters in diameter. You know, you're older, you've lived, you've gone through the prime of your life, you might be in your 90s at this point. We're going to take a conservative approach and we're not going to operate on you. You might anticipate that the physician or the surgeon might say that. On the other hand, a lot of times if the aneurysm is greater than 5.5 centimeters in diameter, and in different textbooks and different research has different values on this, but essentially the bigger the aneurysm, the more likely that the physician is going to go ahead and operate it. They might put a graft, they might clip it. There's a lot of different things that the physician might do surgically to repair and sustain a patient who has an aneurysm. Why? Because if a patient has an aneurysm and it ruptures, the chances of them actually living are very, very low. The big thing when going through a patient scenario is to make sure that you do a lot of prevention. Control hypertension, make sure that you don't palpate the mass, make sure that you just keep that blood pressure low. Again, these are all things that we want to do to make sure that we prevent a unruptured mass from becoming a ruptured one. Again, my name's Nick the nurse. I really appreciate you watching our video, and we'll see you next time.